I'm Dr. Jillian Coolen, an obstetrician in the IWK Pregnancy and Diabetes Clinic. This video answers some frequently asked questions about using metformin in pregnancy. A question we get asked a lot is, why do I need metformin and how does it work? For many women with gestational diabetes mellitus, target blood sugars cannot be reached with diet and exercise alone, and medical therapy is needed to prevent complications for you and your baby. Metformin is an oral medication that can lower and control your blood sugar levels by helping your body use insulin better. We often get asked, when should I take metformin? It works best if you take metformin with your breakfast and with your supper. One thing you should know about metformin is it can cause side effects. Not all people suffer side effects of metformin, but they can be common, especially if your dose goes up and when you first start taking it. Many women get gastrointestinal side effects like nausea, a metallic taste in their mouth, poor appetite, flatulence, loose stools like diarrhea, and some stomach cramps. But fortunately, after you've been on the dose for a few days, those side effects should lessen and often stop. If your side effects continue for more than a week, let your doctor, your team know, and we can either reduce your dose or try something else like insulin injections as an alternative. We know that taking your metformin with food will lessen or avoid some of the side effects of metformin. We often get asked, like, how soon after I start metformin will we start to see an improvement in blood sugars? And this will vary from person to person, but this medication can work really quickly, and we might see an improvement in a few days, but definitely in a week or so. Some people ask us if they can go back on a normal diet after they start medical management with metformin or insulin, but we still recommend staying on your diabetic diet for the rest of your pregnancy. Another question we get asked is, what happens if the metformin doesn't work? Well, we know it's going to work for some women, but not all women. In fact, about 40% of women with gestational diabetes on metformin will still need insulin. And that's where we're here to help. We'll help follow your blood sugars, and if the metformin isn't getting your blood sugar to target, we'll teach you how to start and take insulin safely. Often we get asked, will I need management for diabetes after the pregnancy? And if you are truly gestational diabetic, then your diabetes will go away after delivery, and you can stop both metformin and insulin. The most important questions for me to answer today is whether or not metformin is safe for your baby. And I want to reassure you that although metformin crosses the placenta, research studies have shown that it is safe to use during pregnancy. There are no known side effects to the baby from taking metformin in pregnancy. In fact, metformin has some additional benefits to your blood sugar control. It can help reduce gestational weight gain and might even help with prevention of high blood pressure in pregnancy. One thing I'd like to emphasize is that in addition to being safe for your baby, metformin is safe for you. It cannot lower your blood sugar to dangerously low levels. And for those of you who are being put on this medication the first time, we wanted to let you know that it is covered by most drug plans. This medication has been around for a long time, and that even if you don't have a drug plan, we've looked into the cost, and it would be approximately $15 a month without a drug plan. We hope that this video has been helpful and answered your questions about using metformin in pregnancy. If you have additional questions, please don't hesitate to ask your doctor or our team. We are here to help you and help your baby.